Well, has your doctor talked to you about having a hysterectomy and maybe they mentioned the total vaginal hysterectomy and you weren't sure quite what that was and how it differs from the other? Well, today we're going to talk about the total vaginal hysterectomy. That sounds good to you? Continue watching. Well, welcome back to my channel. I'm Dr. DuPont. I'm a board certified gynecologic oncologist, and I'm passionate about educating women on how to live healthier and longer lives. And I believe that begins with great health. For those of you who watched my total vaginal hysterectomy video that I did last year, thank you, thank you, thank you. That was my most watched videos. It had over 45,000 views. There were some things that I forgot to put in last year's video that I wanted to put in this year's video. So I decided to just remake the whole video and to make it better. So I hope you enjoy it. Well, when we talk about a hysterectomy, it's one of the most common procedures done in women. Again, the hysterectomy is only removing the uterus and cervix. So whether or not the ovaries or tubes come out will depend on your age, depend on why you're having surgery. And so that'll be a separate discussion between you and your surgeon. But a hysterectomy is just removing the uterus and cervix. So when we talk about a total vaginal hysterectomy, how that differs is that the uterus and cervix are coming out through the vagina. So if you're having a vaginal hysterectomy, the cervix has to come out because there's no way it can get out otherwise. And so we either will take the tubes and ovaries and pull everything out through the vagina, or we'll keep the tubes and ovaries or keep the ovary and remove the tubes. It just depends. There's many different variations. But anyway, all of it comes through the vagina. The vaginal hysterectomy is a very wonderful procedure. I know when I was a resident and learning the procedure, it was actually the one that I thought was so much fun. It does take a lot of practice and a lot of skill, but it's a really nice procedure and it's really simple. So all you're doing is removing the support structures that are holding the uterus in place. You're making an opening between the uterus and the bladder and then between the uterus and the rectum. Once you get those spaces open, you're just cutting the attachments and the uterus pretty much just falls on out. So it's a really great procedure. I don't do it as much because I am a cancer specialist. So, the patients I see have big masses and you can't pull those big masses through a small opening in the vagina. So a lot of times my patients don't qualify for a vaginal hysterectomy because they have, big fibroids or big ovarian masses, or they have cancer and I need to do a lymph node dissection. You can't do all that vaginally. So for those patients, they have to have a different type of surgery. But for those other types of surgery where it's the total abdominal hysterectomy, a total laparoscopic hysterectomy, or a laparoscopic assisted vaginal hysterectomy, please see some of my other videos in my surgery series where I go into detail about those particular types of surgeries. Well, so what happens before the vaginal hysterectomy? So it's very similar to all the other hysterectomies that, I've educated you guys on over the past 2 years. Your doctor may have you go medical clearance depending on your age and your health status. A lot of times you'll go to the hospital or surgery center for the procedure, but you'll also go ahead of time to kind of register for your surgery. And then on your day of surgery, you'll meet with your anesthesia team, you'll meet with the nursing team, and they'll kind of go over what's going to happen during that day. You'll see your surgeon before the surgery starts. And then once you're in the surgery, this particular surgery is a little bit different because of the positioning of the surgery. We have to get all of our instruments in the vagina. But for a doctor that does this very often, they're very skilled, and this actually doesn't take very long. It's a very quick surgery in skilled hands. So one of the other things that I forgot to mention last year that we do often with this surgery is this surgery is also done not only for pelvic pain, abnormal bleeding, uterine fibroids, but also done for pelvic organ prolapse. So let's say when you cough or sneeze, you lose urine, or let's say your uterus may come out with the hysterectomy part. The doctor can also do a lot of other procedures, such as place a sling to support your bladder if you're having problems with urination, or if you're leaking, or if you have to, mainly if you're coughing and you're losing urine. So they'll put a sling. They'll also do, an anterior repair or posterior repair to kind of tighten the vaginal tissues. Sometimes people will get laxity after childbirth, or just aging in general can make the vaginal support structures weaker over time. And so a lot of these procedures are done with the vaginal hysterectomy, such as the anterior and posterior repair or the sling procedures. So usually the specialist that does this is a urogynecologist. Please see my video on G1 oncology specialists or subspecialists, and I talk a little bit about that field. They're great physicians. They're just like me. Well, they train for OBGYN for 4 years, and then they do usually 2 to 3 years of extra training in pelvic floor reconstruction. So typically, if I have someone that's having issues with their bladder, I will send them to a urogynecologist instead of urologist. And there's some urologists love taking care of patients with a pelvic organ prolapse. But in my experience, or at least the ones that I know, they're not as well trained as the urogynecologist for the pelvic floor reconstruction. So I typically will send my patients to a urogynecologist instead of a urologist. But the one thing is there's a lot more urologists than urogynecologists. So sometimes the patients may be referred to urologists. And so anyway, so once you had your surgery, and if you have pelvic organ prolapse, you may have had additional procedures during that day. Some of the other procedures that they may do is a cystoscopy where they'll look in your bladder. And I do that often with my robotic cases. And you may have, a coldoplasty or McCall's coldoplasty where some of the ligaments are supported, and that's to prevent future prolapse in the future. So anyway, just keep in mind that if you're having a vaginal hysterectomy for prolapse, you may have other procedures added on to the hysterectomy to treat that prolapse. So that was kind of the short story made long. Okay, so after surgery, the recovery is very similar. The one thing about the total vaginal hysterectomy is typically you stay in the hospital overnight. Most women do very well. When you go home, the recovery is very similar, but you do have less pain because the doctor didn't have to go into the abdomen, so you're not going to get the shoulder pain you would get from a robotic or laparoscopic hysterectomy. You will be told to have pelvic rest. That means nothing in the vagina for at least 6 weeks. Your doctor will probably tell you no tub baths, just showers, because we want to make sure that suture line called the vaginal cuff is free from infection. So usually we'll say no tub baths, no swimming, no hot tubs for about 6 weeks, and then no intercourse also for 6 weeks, just to allow those sutures to heal. Now, some of the advantages of the total vaginal hysterectomy is that it's cheaper. The instruments are cheaper. You don't have a lot of fancy equipment. You have just simple tools. And so it's a very inexpensive surgery. The anesthesia time is less because typically it's a pretty fast surgery. Doctors that do a lot of vaginal hysterectomies are very good at it. They can get it done in 20-30 minutes. So you're not under anesthesia for very long, and has less blood loss, less complications, less infection rate. So overall, it's a very great surgery to have. Now, for patients that have big masses, one of the downsides is that you may not be able to have a total vaginal hysterectomy because if you have a big fibroid or big tumor, that's not going to come out of the vagina. So this surgery may not be for you. So it depends on your anatomy and the reason why you're having surgery if you can have this vaginal hysterectomy. Now, a few of the other disadvantages besides your anatomy would be the surgeon's skill. So I know when I was in training, I had a lot of older surgeons who'd done vaginal hysterectomies, for years and years. Well, we don't do them as often because we have so many different types of tools and techniques that we can use for surgery that the vaginal hysterectomy is not as done as often. So some of the younger surgeons may not be as skilled as some of the older surgeons, like when I was still in training. But definitely if you see a urogynecologist, they do this a lot because they do a lot of reconstruction in terms of treating prolapse. So they'll be very skilled at it and they'll be very fast. So one of the disadvantages is surgeon skill. Another disadvantage would be, besides surgeon skill, again, is anatomy that we had mentioned about the big masses. Also, if you're someone that has a very narrow pelvis and maybe you didn't have children, it may be more challenging. So not all doctors may offer you a vaginal hysterectomy, but overall, it's an excellent procedure. Patients do recover well. They're able to get back to work sooner. And so it is a very great procedure to have. So if you're someone that had a vag hyst and you had an experience you want to share with us, please put them in the comments below. Well, if you want a copy of the discharge instructions that I give my patients, please check the link below. I do have a hysterectomy discharge instruction sheet that I give to my patients. And I did do also a nutrition guide. If you're interested, they're all free. You can check the link below and get any of my guides. If you find them helpful, I'm happy to provide them to you. Well, thank you for watching to the very, very, very end. If you're new here and you enjoy this video, please give me a thumbs up. If you have not subscribed, please, please, please subscribe. It does help me to be able to reach more people. And I thank you for watching, and I'll see you in the next one. Bye-bye.